Welcome to the Healing Grove podcast. I'm Dr. Kristin Reihman, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Hi, everyone. Welcome back to the Healing Grove podcast. I'm Dr. Kristin Reihman, your host, and today my guest is Dr. Kristin Reihman. And that's a little weird, I realize, but as I was thinking about how to tell this story, it occurred to me that I've never actually been interviewed about my brain healing journey in a complete way. And I thought I would do it the same way I would interview any other guest. So welcome, Kristin, to the Healing Grove podcast. I'm so glad to have you here today.
Thank you. It's great to be here and a little weird to be talking to myself.
Yeah, I know, right? So before we get into it, I really would love to hear a little bit more about why you're telling this story. It's a bit odd, right? Sharing a story about something that happened that can make you seem really vulnerable. And I know a lot of people wonder about what that's like for you and why you wanted to share it all first in an email series and now here.
Yeah, I'd be happy to. So I wrote that email series because I have an event coming up that is all about brain health. And I wanted people to understand what my angle is on this and what my take is, and just how meaningful it's been to me to know this information that I want to share with everyone else.
Yeah, I get it. That's super generous of you. But is there any part of you that's like a little awkward sharing this?
Well, it's I don't know, sort of second nature for me. People often ask me why I'm so comfortable sharing stuff about myself, and I guess I'll say that it's not super comfortable, which is maybe why I do it. I feel like I have a tendency to make myself lean into things that cause a little bit of discomfort or cause a little bit of uncertainty, and that's my nature. Yeah, I guess that's why. It doesn't bother me for people to know that I had a brain injury. I do have this awareness that for a lot of people that means something, terrible and forever, but I think part of what I'm doing here is trying to break down that assumption and that understanding and change people's minds about the fact that their brains can heal and grow.
Yeah, that resonates. So you love talking about trees. And you've hinted in your email series about your brain journey that you really invoked all limbs of your tree for this healing and this recovery. Tell us a little bit more about the tree and where it comes from and what it means.
So I love talking about the tree. And this is not my idea, by the way. This is something I have borrowed from Will Miller, who is one of my greatest teachers and one of my faculty mentors during my residency program in family medicine at Lehigh Valley Hospital. Will is a former anthropologist turned doctor who had lots of beautiful stories and schematics, ways of sort of understanding the relationship between doctors and patients and the relationship between patients and their lives and their illness journey. And one of those methods was the tree of healing, or the tree of naming. He called it different things, but essentially it was a tree with 5 limbs, and each limb represented a different part of our being. So there was a physical limb, which is what often patients are coming in to see us about. They have some physical pain or some symptom or say a brain injury in the physical limb. And that's something that we doctors usually see on the front lines. But underneath that, there are all these other limbs that have interplay in the physical body. So there's an emotional limb. People are often grieving the loss of some physical aspect of themselves, or they're afraid, or they're just, concerned and worried and want to have an answer. That can feed into the conceptual limb, which is the thinking part of ourselves, right? The part of ourselves that likes to tell stories about what this means for us. a lot of people with a brain injury or with mild cognitive decline, which I would call an early brain injury or a mild brain injury, tend to tell themselves the story that, wow, this can't be fixed. This is a, done deal. Brains don't heal, brains don't regenerate. That's just a story, and it turns out not to be true. So we have to really think about all the different parts of ourselves, including the stories we're telling ourselves. Because if we're telling ourselves a story that says, I can't heal from this, guess what? All the cells in our body are listening to that. They're all taking commands from our thoughts. And if we're saying either consciously or subconsciously that I can't heal, or that I'm not worthy of healing, or that healing is not possible, or it's too late for me, or I don't have the support I need, all of these thoughts trickle down and manifest in our cells as disabilities, as inability to move forward and heal, grow, heal, organize. We also have a social limb. This is the part of ourself that reaches out to others or doesn't when we need help. And so to the extent that we can connect with a healing team and people around us, all the other limbs of our tree can benefit. And then we have a spiritual limb, although I think we'll often put it on our thumb. But essentially, we have these 5 limbs. The spiritual limb, of course, is that part of us that's connected to something outside of ourselves, something greater than ourselves. For me, part of my spiritual limb thrives when I am gardening. That's why I wanted to be sitting in my garden for this interview. So surrounding myself with things that I have grown from seed that I actually did very little to grow. I just put a seed into some healthy dirt and I gave it water and light, and then this happens, and you can't see the ripe ones. I plucked a bunch of ripe tomatoes off recently, but there's, just this abundance of life that happens when you garden. And so it's part of how I feel connected to something outside of myself that's larger than myself, that takes place whether I'm thinking about it or not, and that brings me great joy. That's how I nourish my spiritual limbs. So yeah, I think healing happens on all 5 limbs. If you're really going to do the job right, you have to make sure you're invoking them all.
I love that so much. Yeah, just hearing you talk about it reminds me of learning it in residency and feeling so grateful to be part of a program where doctors around me were steeped in this paradigm of understanding that we're whole beings. So thanks for that reminder. So in terms of your tree, which limb would you say struggled the most during this recent injury, this brain healing episode?
Wow. That's a really good question. I think it has to do with, for me, I think the hardest hit limb for me, I mean, obviously the physical limb was hit. There was something that happened in my brain. I think in the past, a lot of my conceptual limb would have been really stirred up by such a thing. Certainly when I had Lyme disease, a lot of my suffering came from this sort of worry about what this meant and thoughts about what by going outside of the guidelines to treat and heal Lyme would mean for my relationship to my peers and my place in the structure, my place amongst my tribe. There was a lot of conceptual suffering. And until I finally got that sort of fixed, I really didn't feel like I was healing. But in this case, not so much. It was sort of remarkable to me almost how little I cared. I mean, and part of that might have been the brain injury, right? Part of that could have been my pons and my medulla and my cerebellum just being like, we're hurt, dude. Like we don't really feel it. We don't want to work hard to get well. And I'll tell you that was maybe scary to other people, but it wasn't scary to me. So my emotional limb wasn't super stirred up. My conceptual limb wasn't super stirred up. My social limb, I still had family around me. I had friends around me. I had really good friends around me who were encouraging me to do something about this, and not just encouraging me, but then like making appointments for me because, well, brain not working. Like I wasn't able to really take that next step. The motivation wasn't there, nor was the execution or follow through. So, my social limb was pretty robust. And my spiritual limb also, I think, was strong. I mean, I was already kind of moving into this phase of, okay, well, if my brain doesn't work, I can garden, I can be more connected, I'd be more present for my family, have more time for things that matter to me, connect to my spiritual self. So I think it probably was the physical limb. I got really strong again after my Lyme journey, and I was able to do things I never imagined I could do again. Like start a running practice for a while and yoga. And, I didn't ever feel weak or unable to to physically move my body in the way I meant to and wanted to. And the brain injury really hit me. I mean, I couldn't manage going downstairs without getting super uncomfortable. And I don't even know how to describe it. I would just get like this sense of impending doom. Like I couldn't even finish a sentence. Something bad's going to happen. And it felt that way getting out of swimming pools at night. My peripheral vision would get all wonky, and I would start to feel like I had, MS or something. I was like stumbling, and walking over uneven terrain was really difficult. I mean, it wasn't massive, but it was significant. And it made me feel like I couldn't do physically the things I love to do. So I would say for me, the hardest hit was my physical limb, which is interesting saying. I hadn't really thought about this before. But I think the fact that those other limbs were sort of in good shape made it a much easier journey than it might have been. Yeah.
Interesting. So you sort of touched on some symptoms that you were experiencing. When did you first realize, like really understand that this was a brain injury?
Okay, so that's a little hard to answer, because one of the things about a brain injury is when you have a brain injury, regardless of where in the brain it is, there's often some cognitive capacities that are also affected because of the inflammation that happens as a result of that injury. And what I can tell you is that I don't remember thinking this is a brain injury until I went back to work. And that was like 4 or 5 months after the surgery. So I had this surgery on my neck. I woke up, I couldn't speak. I sounded like this when I spoke, or worse. I think I have some recordings somewhere of that, but it was awful. And I was told that that was a normal, expected potential side effect of the surgery, because when they go in through your neck, they can damage some nerves, they can stress the muscles there. And they said, well, we don't know if it's going to be a 2-week situation, a 2-month situation, or a 1.5 years. And I was like, really? People pay you for that kind of prognosis making? But essentially, there's 3 different mechanisms of action, and it's unclear what yours was until you recover from it. So I actually recovered my voice after 2 months when I got COVID, strangely. Thanks, COVID. But I didn't work during those first 2 months. So I wasn't challenging my brain in the same way as if I had been working, right? So the other thing that happened is I was taking a lot of drugs before that surgery. The 2 weeks leading up to my surgery, I was in so much pain. First of all, I can't move my neck that way anymore because I have this is some titanium in there. But my head was essentially on my shoulder because I was trying to unload the nerve that was creating the pain shooting down my arm and making it impossible to think straight or sleep without 4 medications on board. So I had, all sorts of medications on, which I'm not usually a medication taker. So there was that. I had medical marijuana because the medications weren't actually working and I needed something. And I actually went through the whole process to get a card because I was like, I don't know what else I'm going to do. Like I can't manage this level of physical pain. And that made it finally, able for me to sleep. But then for the 2 months after, I was still on some of those medications because of the post-surgical pain. The arm pain was better. I still had some numbness here, but I had a lot of pain in my neck, like in the back of my neck, which was surprising and new, and also at the scar site, but mostly in the neck. So it was all these drugs. So my brain really wasn't working anyway. And I didn't expect it to be, and I wasn't challenging it for the first couple of months. And then my voice came back and I recovered from COVID. And it was an easy COVID. It was like 3 days of fever and aches, but it was easy after that. And a lot of people said, well, maybe your brain was injured from COVID. Maybe this is COVID brain. And I say maybe, but the stuff that eventually sort of became the diagnostic criteria for my brain injury, in retrospect, were all there. So for the first thing is I couldn't balance well. Like I was mentioned earlier, I had trouble walking downstairs. I had a new puppy and the puppy was all around my feet. And it just made me feel like I was going to topple over. Having that puppy around my feet just led to this experience of I'm going to die. And, that was unusual. And I sort of chalked it up to maybe that was the anesthesia still in my system, or maybe the drugs I'm on, but I didn't think of it as a brain injury initially. And then the second thing I noticed was that my vision was blurry. So I had glasses and I wasn't sitting in front of a computer. I wasn't working at that time. So I didn't really think much of it. I just thought, oh, maybe it's time to get new glasses. People go through different prescriptions of their lifetimes. I'm relatively new to glasses, but I figured that's the thing and I have to go get it checked and maybe it's time for a new prescription. And so there was that. And then I didn't notice this until I went back to work, but there was some cognitive issue. There was an inability to multitask. So the way I describe my world as a doctor, seeing very complex patients who have very long histories and also lots of, mitigating factors that could or couldn't be, maybe aren't the sort of part of the problem. I'm holding all those pieces in my mind at one time. I kind of feel like I'm in the matrix and I'm moving things around and I'm seeing connections and I'm doing all this work kind of in the background while I'm listening and maybe taking notes. And I simply couldn't do all that at once. So I went back to work a few months after my surgery and I had a pretty heavy schedule. I had back-to-back patients for 4 days in a row as in Amish country. And those patients are scheduled in such a way that I don't have much time in between them. It's not my decision, but it's the way it is. So I was seeing all these patients and, 4 or 5 families a day, which normally wouldn't be a problem, but I was exhausted. I was incredibly exhausted. I felt like I could close my eyes at any moment and sleep, which is unusual. I was also yawning a lot as if like I hadn't slept the night before, but I had clearly slept the night before. So that was strange. I was also having trouble doing simple math. So, a lot of times we'll have the Amish dad stand with the child on the scale and we'll weigh them together. And then the dad will hop off, hand the child to mom and get back on the scale and get his weight. And we always joke about how it's your weight's free, right? He gets on the scale and then I subtract those 2 numbers and I find the child's weight. I couldn't do that. I couldn't do it in my head. What's strange is I couldn't even do it when I got to a piece of paper or my calculator because I couldn't remember the last 2 numbers that I was trying to subtract from. So that was new and that was concerning. So at the end of those 4 days, I was standing in the kitchen and my boss, Matt Newell at the Family Hope Center, walked up to me and he said, "How are you doing?" And I was like, good. I'm really happy to be here. I'm happy to see patients again. It's fun to see the families, but I'm really tired and I can't seem to do simple math. And he goes, "Yeah, I was wondering if that was the case because you have a right lateral strabismus." And I was like, what? And in that moment, all these pieces started to click together, all these little, that balance thing, it's not a big deal. It's probably the anesthesia. Oh, that eyesight thing, that's probably just new glasses that I need. And suddenly I was like, oh my gosh, I've had a brain injury, haven't I? And he said, yeah, you had a few based on what I'm seeing, but we know how to fix that. So we do, we'll fix that lickety split. And of course I was like, so that was when I first knew for sure that I'd had a brain injury.
Wow. I remember that. That was terrifying, right? Whoa. Okay, so that was you sort of figuring it out. What about your family? Like, how did they respond to this, and what was the impact of this on those around you?
Yeah, it was scary. Even though I knew what to do, it was scary for me, and it was really scary for my family because they'd noticed stuff too, and I think they'd also been kind of normalizing it and figuring, oh, this is just post-op anesthesia, this is just post-COVID, this is get better, and yet they were clearly seeing things that were new. So I asked my husband, I'll tell you a story that I think exemplifies this. It still kind of freaks me out because I don't remember this. I don't remember a lot of that time, to be honest. But several months into my brain healing project, which came, 6 months after what I'm about to tell you now, I asked him, are you seeing a difference with what I'm doing with my brain healing project? He said, yeah, totally seeing a difference. And I said, really? I mean, because I'm feeling different, but like, tell me what you're noticing. He said, do you really want to know? Yeah, I really want to know. Really? Yeah, yes, now I definitely really do want to know. And he said, well, I mean, okay, I'll just give you an example that happened more than once. We were all sitting around, this is around Thanksgiving. We were sitting around after the dinner table talking, and you're doing all the dishes, and you finish the dishes and you go and feed the dog and you come back in and you're like, oh, thanks for doing the dishes. And I was like, are you sure that that wasn't just me being like sarcastic? Because you guys are just sitting around doing nothing and I'm doing everything. He's like, no, no. And that had happened probably more than one time that day. I was like, oh my googly moogly. So they were scared. And mostly it was Greg, mostly my husband, because I don't think the kids noticed as much. I know my daughter noticed. She's always like right up in my kind of emotional and conceptual biz. And she would say things like, Mom, are you okay? Like, is your brain okay? And it wasn't. It wasn't. When I was really focusing on things and really trying to pay attention and trying to do my matrix thing, I could do it. Like I could do it. It wasn't like I was unsafe, I don't think, seeing patients, but I had limited my schedule significantly so that I didn't have to do it back to back. And I had everything else, all the distractions were shut down so I could totally focus. And it was exhausting. I was yawning, like in the middle of patient care. I was like, oh, unprofessional. But that's what it took. It was an exhausting effort to just keep everything in front of me and focus. So yeah, we were all impacted. It was scary.
Crazy. So now right? You have had a brain injury and you have some tools at your disposal, right? You know what to do. So did you just do it? Like what happened next?
So this is where I want to give a big shout out to my healing team, because if it were just me, I wouldn't have done anything about this. I remember having a moment, probably 3 months, like right after my voice came back, when I was like, okay, I'm going back to work. And I was still using some medical marijuana, like on this, rubbing it in and stuff. And I remember thinking, and it definitely altered me, it definitely made me feel like a little high. And I remember thinking like, I don't really need to work. If my brain's not good enough to work anymore, I don't need to work. Suddenly had this moment of like, oh my gosh, I need to stop taking that medical marijuana. Like, I don't really care about anything, any of my goals, any of my dreams. The only thing I really wanted to do was like play with puppies and sit at home with my family and maybe garden a little bit. And I had this moment where I was like, oh my goodness, I'm not sure this stuff should be legal. I'm just not sure what impact this is having, like on a large scale with so many people doing it now, including me. And the next day I just stopped. I was like, I don't care if it hurts. I'll use Voltaren cream. I'll use something else. I need to take that piece out of the equation. So that was the first step, I think, in the right direction. But I still didn't want to get in the ring with my brain healing project because I know how hard it is. Like I know what it takes. I shouldn't say how hard it is. It's a commitment. It's physically doable and it's a commitment. And I just was like, I don't really like, do I really need to do that? And in retrospect, that was part of the brain injury too, because motivation lives in the pons, and it's an intact pons is required for you to have that internal motivation to do something, to make yourself better, to improve upon a situation. And it wasn't there for me, I'll be honest. And so this is where I am really grateful to my healing team. So this is when a colleague of mine said, you need to get to see this functional neurologist. I think they will help you get that mojo back. And here's their number, and you're calling them right now and making an appointment. And so I did. And I went the following week to this functional neurologist, which is a specialty that is often utilized not by MDs, but by chiropractors and PTs and OTs. And it's a fabulous, fabulous tool for jumpstarting neuroplasticity, which is exactly what happened. So I went to this guy. Drove to New Jersey, 2 hours away. I stayed overnight. I did 2 full days of visits back to back because his recommendation was 6 full days over the course of 3 weeks. So I just booked it in. And within those 3 weeks, I got my mojo back. I wasn't healed by any stretch. I still had terrible balance. I still had an eye that turned out. I still had trouble multitasking, but my light was back. My belief that this was an injury that I could overcome and should overcome and wanted to overcome for the long-term goals, all that came back. So thank goodness for my healing team.
Wow. So you felt something significant change in just 3 weeks. That's a really powerful message. So what else did you do? Did you continue going, or where'd you go from there?
So after the functional neurologist, I would say I was like 50% better, you know? There was still all those other issues, but I was functioning at a much higher level. And I wasn't forgetting things as much. You know, I was able to have conversations and remember what had just happened. And so I knew I was on the right track. But then I also knew that there's this whole other piece that the functional neurologist wasn't getting at. And that has to do with really invoking deep level healing from the ground up. And that's all the stuff I learned at Family Hope Center. You know, I've been their medical director for the past 10 years. And during that time, I've watched 2 of my kids do their program with really great results. And I've watched hundreds of kids from around the world heal from all manner of brain injuries, including ADHD, dyslexia, autism sometimes. Certainly cerebral palsy gets better, like blindness goes away when you know how to invoke neuroplasticity at a deep level and the optic nerve is intact. I mean, there's just, it's actually unbelievable, the results they're getting. And I'd seen it for 10 years. So I knew that this was, like Matt Newell had said, not a big deal. Like I could do it. And he said, give yourself 100 days. That's it. 100 days of transformation. Just do the work and do it for 100 days and you'll be amazed. So I got myself a little book. To chart my progress. I used my productivity planner from other projects that have been very effective. And I would just make every day a series of circles. And I would fill in the circles as I did all the things. And all the things included things like smells, you know, sniffing essential oils several times a day, deeply, you know, and thinking about what I thought the smell was, which is using 2 parts of your brain at one time. And I would do that 4 times a day, 4 smells for 20 seconds each. I would also do reflex bags. You know, part of our protocol at the Family Hope Center is we bring more oxygen to the brain than is there naturally. And we do that by putting little reflex bags on our face. I know it looks alarming. Don't be alarmed. And breathing back and forth into the bag several times until a certain reflex happens. And that reflex that is basically your baroreceptors in your neck talking to areas in your blood vessels, that reflex opens up blood vessels all over your body, but in particularly in the brain, increasing blood flow to the brain by 70%. So that in and of itself is not going to heal the brain, but it certainly gives your brain more resources to heal with, including oxygen. And then the big piece of it was creeping and crawling. So creeping and crawling is something that has been known to the neurology and neurological fields for 100 years, but it's not well utilized. And that's why I love the Family Hope Center, because they are using this tool, which is something everyone has access to if they have a floor, to help invoke the neuroplasticity and the changes that heal a brain. So I actually wore my little outfit today. I was going to show you what that looked like. That's why I'm not in my profesh clothes today, because basically for 8 months, every morning, 5 days a week, 6 days a week, at least 5, sometimes 6 days a week, I would get down on the floor with my arm pads and my knee pads on, and I would move myself along the floor in such a way that different reflexes, primitive reflexes, the same reflexes that are present in a baby, a newborn baby, that allow them to move themselves in a commando-like belly crawl across the floor, that allow them to root and suckle, that allow them to grasp on things. All those reflexes, or most of them, get stimulated when you lie on your belly like a commando and move yourself across the floor. And when you pop up on hands and knees and creep across the floor. So as you can see, I have on my knee pads, and I also have on, let's see if I can do this, my toe shoes. And this was my uniform for about 8 months in 2023. So from January 2023 until August, mid-August, September 2023, I was creeping and crawling on my floor every morning or afternoon or both to heal my brain. And does it work? Well, you tell me. It works. It's pretty amazing. My eye came back, my balance came back, and my brain came back. So that's what I did.
So basically every morning you're getting on your sweats, you're getting on your knee pads, you're getting on your toe shoes, and you're going to town on the floor. What did so it's painting a picture already, but like break down a little bit more what your life was like during those 8 or 9 months when you were actively healing your brain.
What was my life like? Well, I definitely ratcheted down the number of patients I was seeing. I was seeing 1 or 2 people a week because the rest of my time was devoted to this. Hi, you want to come up? Come on. I was cuddling my puppy. In fact, my dogs loved creeping and crawling with me on the floor. They would get super excited. They would start going at each other and jumping around, and I'd have to sort of brush them aside as I was like moving past them, swimming past them on my floor down my hallway. I know that was so fun. Those were good times. I think my kids were a little, I don't know, it'd be an interesting question for them now. I think, they've been in the mix with me for the last 10 years, right? So they've seen me talk about and heard me talk about Family Hope Center. Even 2 of them, the youngest 2, I had creep and crawl for a couple years each just to optimize their brain, tighten things up, and lose any whiff of ADHD they had. And so we have a love-hate relationship with creeping and crawling, I guess I should say. Like, I think we love the results we've seen. There are some in the family who sort of still deny that that's where the results came from. To me, it's really pretty clear. But I think that at its core, everybody had seen how bad I got, and they wanted it to get better. I'll tell you a story. So, when I initially asked Matt for a program, he gave me 300 meters of creeping and 300 meters of crawling, I think. Or maybe it was 3 and 6. 300 meters of crawling, 600 meters of creeping, crawling being on your belly, creeping being hands and knees. And that was per day. And he said, don't start with this, work slowly up to this as tolerated. So, I was really deconditioned. I hadn't done any exercise in over a year because of the neck injury, arm pain. And so I was pretty out of shape. And I started with like 50 meters. So that was just 5 up and downs of my hallway. And I was exhausted. My heart's pounding, And after about a month at 300 and 600, I was feeling pretty good. I was noticing a difference. I felt like my brain was organizing every morning. I would get down on the floor and I would creep and crawl. I would crawl for like 80 meters, and all of a sudden I'd be like, I understand what I'm doing today. I know my place in the universe. Like, I know the next steps and the next steps after that. Like, whereas before I'd kind of been like adrift, I've never been a coffee drinker, but I felt like that transition seemed to me the way other people describe getting coffee in the morning, where their brain wakes up. Well, I feel like I'd crawl for 80 meters and my brain would suddenly like, everything would integrate. And I started to doubt that I was doing enough. Like, I started to have questions because looking back at what I made my kids do based on, the Family Hope Center recommendations, Matt Newell telling them, they should crawl 900 meters and 900 creeping. And they had done that for months and months and months and years. And I was only doing 3 and 6. So at one point I called up one of the team at the Family Hope Center. I was like, here's what I'm doing. Can you look at the video of my creeping, look at the video of my crawling, tell me if it's enough. And Maria, who was the member who was looking at it, said, yeah, you look good, but how much are you doing again? That doesn't seem like very much. And I was like, well, that was kind of my suspicion too. What do you think I should be doing? She goes, yeah, I don't think Matt knew you wouldn't be working. So he was trying to make it reasonable and doable. But since you're not working, you have time, right? Like, you should be doing 900 meters of crawling and 3,600 meters of creeping, like 3.6 kilometers of hands and knees creeping. And I was like, oh my gosh. And I shut down. I just stopped. I was like, I can't do that. So for 2 days, I think I just wallowed, cried to everyone who would listen, cried to my kids. I can't believe that Maria said Matt's taking it easy on me. Yeah, I just like really demoralized. It was a good reminder of like, don't ask too much of people, because they shut down, and I definitely shut down. And so a couple days later, I was like, you know what? I was noticing differences on 300 and 600. I'm just going to go back to that and do that. So I did that for a couple of days, and I took my daughter to her physical therapy appointment, and on a Saturday. I took all my gear because I was carrying this stuff around with me. I was like, look, if there's a flat surface and I haven't crept and crawled, I'm doing it. So I asked the front desk person at the physical therapist, I was like, do you mind if I get my knee pads on and like creep and crawl around your office? And she was like, sure. So I did that and cranked it all out, got my 300, my 600 in. And when she came out of therapy, we're in the car and I'm driving and I was like, Tool, I'm so excited. I got my whole creeping and crawling done and it's Saturday morning at 10:15 and I'm done, mischief managed. And she like turned to me, she goes, was that your whole program, Mom? Or was that a third of what Matt told you to do? And I was like, Tula, what? How can you do this to me? I'm like, wah. She's like, Mom, this is your brain. We're your family. We need you to have your brain back. You need to stop seeing patients completely, get back on the floor, creep and crawl, do the whole program that Matt Newell told you to do, and just get it done. And I said, wait, are you being serious right now? She goes, why? Is it too much? Too much. I was like, well, I mean, is this for real? She goes, yes, I mean this. And I was like, then it's not too much. I'll do it. So I got home, I cranked out another 400 and I never got up to 3,600, but I did another 400 each of creeping and crawling and I never looked back. So like, yay, another win for the healing team, right? Channeled through Tula.
Wow. I love that story. I remember that moment so clearly. It's amazing how when someone on your healing team looks you in the face and says, I see you, I see your potential, I believe in you, get her done, it can be very powerful. So you're about to share all this information in a much deeper way in the Healing Grove, right? For free during Community Week. Tell us about what's going to be going on during that week.
Yeah, so I want to share this stuff. You know, there are only a couple places that I know of where people can really learn all the ins and outs of brain healing. You know, the recent podcast with Heather Sanderson is a fabulous place to start. You know, she's got this whole center in San Diego where she's reversing cognitive decline, reversing Alzheimer's, getting people back to independence, using pretty much everything we teach at the Family Hope Center minus creeping and crawling. So for someone who didn't have a distinct injury, but just has inflammation, that's a great place to start. If you've had an injury, if you have sort of focal deficits, or if you've always had a brain that glitched out, then the creeping and crawling probably is part of your future if you really want to get that back. And so I am hoping to share everything I know, everything I've learned, all the resources I'm tapped into over the course of a week, because I want people to have this information. You know, Matt and Carol and the Family Hope Center team put on this beautiful lecture called the Parent Training Conference every few months. It's now online. People can watch it online. But before it was online and I was showing up and giving a lecture for nutrition, I would sit in the back just listening to this team do their magic. And every single time I was just like, I need to be live streaming this to Times Square or making a TED Talk of it. Like, this needs to be in everyone's household. It's just such important information. I don't know a single person who hasn't described some brain glitches. My 13-year-old said the other day to me, I was listening to Harry Potter on Audible and I was noticing something really strange. What's that? Well, no one ever says, or seems to lose their train of thought. It's like, interesting, isn't it? I remember a time when that was the case. It's not that case anymore. So yeah, I'm offering basically a series of free talks and a lot of resources during that free week in the Healing Grove. And I hope you guys will come to that, because it's got a lot of information and a lot of actionable things that you'll be able to take away and start right away to do, you know, some small or some large part of working on optimizing your own brain.
Wow. Thank you so much for everything you're doing to get the word out. And thank you for explaining why you're doing it. It's a powerful story. And I can speak to that firsthand. I lived through it with you, you know, very powerful experience and super happy to be on the other side of that. So for those of you listening, if this calls to you, if you also are a person whose brain has been glitching out, or you're caring for someone whose brain is not optimally functioning, and at this point, I don't know anyone on the planet who can say one or both of those things isn't working, isn't the truth for them. I would love to see you at our free week of resources and workshops and talks
I'll be releasing a lot of previous talks I've done with people in the brain healing and neuroplasticity community for your edification and your enjoyment, and also hosting a live workshop every day during our community week in the Healing Grove. Hope to see you there. There'll be a link in the show notes where you can sign up if you haven't already. Have a great day, everyone, and see you soon in the Healing Grove.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove Playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.